So you've had a concussion and you passed the time cycle for a normal physiologic recovery, but you're still feeling symptomatic, meaning you still feel dizzy, you might still have headaches, you just don't feel quite right yet. So let's talk about some of the main reasons why someone may have a protracted or a prolonged recovery after a concussion. When people think about a concussion, they most often default towards the lingering effects of the brain injury itself. And that may be the case, but there are also other factors that may go into someone's prolonged concussion recovery. The three main ones that we deal with in our office are going to be injuries related to the cervical spine, which is the neck. You have the vestibular system, which are the balance centers for your inner ear, and you also have your visual system, which is going to consist of your eyes. Anytime that these systems get disrupted, then there's a chance that it can create prolonged concussion symptoms. When we look at the way that these systems interact, you have your neck, your eyes, and your vestibular system that's providing really valuable feedback into the brain about the status of your head position in space. When you have a concussion, any one of these sites can be injured. At the same time, you may not actually have a physical injury to your eyes or your vestibular system, for example, because those are fairly rare, but you may have a problem with the way that your brain is processing the information that's coming from these systems. When we talk about processing problems, it's helpful to think of the brain as a computer where it's taking in all the senses that are coming in and it's trying to make an accurate picture of the world around us. And these problems can happen either from a failure of one of the senses to transmit information or a failure of the computer to actually make use of that information. When we talk about physical damage to one of our senses, between the eyes, the neck, and the inner ear, it's really the neck that has the highest likelihood of getting physical damage because whenever you take a head injury, it's very, very likely that you're going to take a neck injury as well because of the whiplash type effects that the concussion can have on the neck. When we're talking about the inner ear and the visual system, you're not as likely to sustain physical damage to these structures, although it is possible. But in those situations, it's likely a processing problem where the brain is taking in information from the visual and vestibular system and it's not making good sense of that information, leading to these mismatch problems that can make people feel quite sick. In order to make you and your brain feel better, we have to differentiate between what's physically damaged and what's actually a processing problem. When tissues are physically damaged, then we have to encourage the healing process. Like if it's a damaged neck, then we have to go through the healing cycle and helping the neck heal and repair. Or if it's something like a vestibular injury, then we have to teach the brain how to compensate without that vestibular nerve anymore. If it's a processing problem, then we could use principles of neuroplasticity to help rewire the brain so it processes the information around us more effectively, and therefore that could help overcome those symptoms when we're able to do it properly.